things, let's upgrade that. Now, a couple things about our log roll here. This is as best spinal precautions that we can take, right? As a single rescuer. Having that log roll with the arm high, that's protecting the spine as best we can. Now, when we're taking spinal precautions, what are we trying to do? Yeah, we're trying to keep it straight. Exactly, we're trying to stabilize, and we're trying to we're trying to have as little axial rotation as possible. Now, it's not perfect as a solo rescuer, but that's as best we can do. Now, what if we have another resource? Another person? Where are we gonna put them? Head. Yeah, on the head. So if I can, my rescuer can physically roll that person, well, the next person is gonna be on the head, right? So if Erin comes on in, we work to decrumple our patient, get that arm flipped, nice. Okay, so now we're in that kind of decrumpled position, ready to roll. Now, what about this arm? Should we be concerned about it? Should we flip it? What should we be doing here? Yeah, so maybe this second rescuer will have an easier time getting purchase if the arm's down. That being said, if that's not gonna assist me, you can fold that down. If that's not gonna assist me, don't get too caught up in it, because it's gonna kind of flop wherever, right? And you guys were talking about, which way should we roll the person? Don't get too caught up in it. Sometimes you're going to have to roll the person over their face or over their injuries. Just be intentional with your movement, okay? Now, as the person on the head, I'm gonna line out my body where I think that my patient is gonna end up when we roll them. Does that make sense? So if I'm over here and I stabilize the head while we roll, what's gonna happen when we roll?
Head's gonna turn.
Well, the head might turn, but I also may just kind of be in this weird, pretty much useless for stability position. So what I want to do is I want to anticipate that roll, and I'm going to put my body in position where I'm going to be permanently, right? Once I'm on the head, I'm there for a while till, EMS comes. So I want to be in a stable position for adding support. So I'm going to line out my hands where that head is going to end up. Now come around if you guys can't see. I'm going to line out my hands where that head is going to end up. Okay, so I think if we roll him, his head's going to end up here. So I'm going to take that inside hand that's closest to the arm, it's going to sit on the arm. That outside hand is just going to be placed on the head, and it's going to my hands are going to slowly shift into position of holding the person's head. Does that make sense? So I know that this position seems counterintuitive, but it's productive as we roll the patient, okay? And I'm not lifting or grabbing or tugging here, I'm just supporting as we roll the patient. So if that's my position, what's Erin's position gonna be here? Rolling, where are her hands gonna be? So instead of having the hand to catch the head, well, I'm on the head now. So she's gonna be shoulder hip, right? So you'll be in shoulder hip. Now what if we have another rescuer? So I have another rescuer come on in. Now you're gonna be next to Erin. Now you are going to be at knees and feet. Now we're able to roll the person, we can uncross the feet, right? And so if your hands are in position, what we're gonna do is actually have our rescuers cross hands at every juncture to add as much support as possible. Again, when people are unconscious, they don't have muscle tone. So, and if we had a larger person, we could even bring in a third person. Actually, let's do it. If we had another rescuer, Ramona, do you want to come on in here? And you're gonna actually just be at knees and feet, okay? And again, we're gonna cross our hands. Yep. Exactly, at every juncture. So we're adding more support to the patient, okay? Now we have more momentum as 3 people than 1. So as the person who's giving this directive, I want to be so abundantly clear, especially if you're working with people who, haven't had this training, which is likely going to be most of the time you have to use this. You want to be very explicit about your instruction and don't assume that everyone's on the same page. In this case, I'm going to say what we're doing, how we're going to do it, and make sure that everyone is on the same page, okay? So I'm going to get my hands in position. Now again, I'm going to line out where I think they're going to end up. My body is also in position versus here, right? I want my body where they're going to end up. Line out my hands. Put that hand that's closest to the arm on the arm. Put this hand on the head. Now I'm going to say, we're going to slowly roll our patient onto their back on the count of 3. Is anybody not ready? Okay, 1, 2, 3. How'd you do? How you feel? Feel good. Okay, awesome. Yeah, exactly. Very, very comforting. Now, notice how we gently do that. It's really key that I'm instructing as the person on the head. Who's always going to call that out? The person at the head. Why? Most fragile position, right? You have, the rest of your spine has your abdomen and your thorax. Here you have totally exposed spine. And so it's your job as the provider here, if we have a possible spinal injury, to be protecting that. Now that's the most fragile position. So I want to make sure that I am ready. So as the person on the head, I'm always going to be calling it out. Now a couple more things. Oftentimes people are like, I got the head, I got the head, I got the head, I got the head. When you're holding the head, it's a specific position. Your thumbs are going to be above the ears. Pointer fingers are going to lie below the ears. So the ear is going to kind of sit in this webbing. Your pinkies are going to be rails of support lined out on the ground. Then those other 2 fingers are going to articulate around the skull. So that looks like, in position, this. Where my thumbs are above the ears, my pointer fingers are below the ears, my 2 fingers are wrapping around the skull to support it, and my 2 pinkies are laying on the ground, okay? And then, now if I have to move, which, likely will happen in the however long I have to be here till EMS arrives, right? If I need to make a move, I'm going to drop my hands, and my pinkies are just going to be kind of around the head here. That's going to be like chocks on a trailer. So instead of holding like this, I drop my hands, then I can make my move, okay? Then I bring my hands back into a normal position. That is so that when I make my move and I'm not holding the person's head and okay, I got back in place, right? So drop those hands like chocks on a trailer, okay? Now we're going to do this one more time so everyone can see it clearly.